Have you ever opened your eyes in the morning and immediately felt something wasn't quite right? Maybe your heart was racing for no obvious reason. Perhaps you felt unusually short of breath just walking to the bathroom. Or maybe you noticed a strange pressure in your chest that disappeared after a few minutes. So you convinced yourself it couldn't be anything serious. But what if those first few moments after waking are actually your heart's way of asking for help? What if your body has been trying to send you warning signals for weeks or even months, and they've been so subtle that you've mistaken them for nothing more than normal aging? The truth is, many heart conditions don't begin with dramatic chest pain like we see in movies. In many people, especially older adults, the earliest signs can be surprisingly quiet. They often appear first thing in the morning, when your body is transitioning from sleep to activity. Some people notice fatigue that seems unusual, others wake up dizzy, sweaty, or with an uncomfortable feeling they simply can't explain. These symptoms don't automatically mean you have heart disease, but they are worth paying attention to because your heart is one of the few organs that works every second of every day without taking a single break. Today, we're going to explore 5 morning warning signs that cardiologists encourage people not to ignore. Some of these signs have many possible causes, while others deserve prompt medical evaluation, especially if they're new, worsening, or occurring together. By the end of this video, you'll know what these signals may mean, why they happen, and when it's important to seek professional medical advice instead of simply hoping they'll disappear on their own. And I especially want you to stay with me until the final sign, because it's often dismissed as just getting older, yet many cardiologists say it's one of the most commonly overlooked reasons people delay getting evaluated until a heart problem has already progressed. That final sign may completely change the way you think about your mornings. Before we begin, I'd love to know your age and where you're watching from. Leave a comment below because it's always encouraging to see people from around the world taking an active interest in protecting their heart health. And if you enjoy practical research-informed health information, consider subscribing so you don't miss future videos. Now, let's begin with a symptom that catches many people completely by surprise. Imagine waking up after what should have been a full night's sleep, only to feel as though you never rested at all. You get out of bed, take a few steps toward the kitchen, and suddenly you're breathing harder than you expected. Climbing a single flight of stairs feels more exhausting than it did just a few weeks ago. You haven't changed your routine, yet your body feels different. Could this simply be aging? Sometimes yes, but sometimes it may be something your heart wants you to notice. Shortness of breath after waking isn't automatically a sign of heart disease. It can also be caused by lung conditions, poor sleep, excess weight, anemia, or even seasonal allergies. However, when it's new, persistent, or getting worse over time, healthcare professionals often recommend taking it seriously because it may indicate that your heart isn't pumping blood as efficiently as it should. Your heart's job is to deliver oxygen-rich blood throughout your body. When that process becomes less efficient, fluid may begin to accumulate in the lungs or surrounding tissues in certain heart conditions. As a result, even simple activities that once felt effortless can suddenly become challenging. One reason people first notice this symptom in the morning is because body position changes overnight. Lying flat for several hours can redistribute fluid throughout the body. In some individuals with heart problems, this may make breathing more difficult upon waking or during the night. Have you ever needed extra pillows just to sleep comfortably? Have you ever awakened suddenly feeling like you needed to sit upright to catch your breath? Those experiences don't always point to a heart problem, but they are exactly the kind of symptoms that deserve a conversation with your healthcare provider, particularly if they've never happened before. Think of your heart as a pump connected to an incredibly complex network of blood vessels. When that pump is working efficiently, oxygen reaches your muscles, brain, and organs with remarkable precision. But if its performance begins to decline, your body often compensates quietly at first. You may simply notice that ordinary tasks feel more difficult than they used to. Many people dismiss this by saying, "I'm just getting older." But healthy aging alone doesn't usually cause a sudden change in your ability to breathe. That's why paying attention to changes, not just symptoms themselves, is so important. One retired mechanic noticed that every morning he had to stop halfway up the stairs to catch his breath. At first he blamed the weather. Then he blamed his age. Months later, after finally mentioning it during a routine medical appointment, further evaluation revealed a heart condition that benefited from treatment and lifestyle changes. Looking back, he admitted the warning signs had been there long before he recognized them. His story illustrates an important lesson. Your body often whispers before it shouts, and the sooner you recognize those whispers, the more options you may have for protecting your long-term heart health. But here's what many people don't realize. There's another morning symptom that's even easier to ignore because it usually lasts only a few minutes. Many people assume it's caused by sleeping in an awkward position or getting out of bed too quickly. In some cases, that's exactly what it is, but in others, it can be your cardiovascular system telling a very different story. Have you ever stood up from bed and felt the room spin for just a few seconds? Maybe you grabbed the edge of the nightstand, closed your eyes, and waited for the feeling to pass. Once it disappeared, you continued with your morning and forgot all about it. After all, everyone gets dizzy once in a while, right? Sometimes that's true. Standing up too quickly can briefly lower blood pressure, causing temporary dizziness that isn't necessarily dangerous. Dehydration, certain medications, inner ear problems, or even a poor night's sleep can also play a role. But if dizziness begins happening frequently, becomes more intense, or is accompanied by chest discomfort, fainting, unusual fatigue, or shortness of breath, it's a symptom that deserves medical attention because it may reflect changes in how effectively your heart and blood vessels are delivering blood to your brain. Think of your circulatory system like a city's water supply. Your heart is the main pumping station, and your blood vessels are the network of pipes carrying oxygen and nutrients to every organ. When that system isn't responding efficiently, the brain is often one of the first places to notice because it depends on a constant supply of oxygen-rich blood. One important reason this symptom appears first thing in the morning is that your body undergoes a rapid adjustment when you move from lying down to standing. Your heart rate, blood pressure, and blood vessels all have to adapt within seconds. Most of the time, they do this effortlessly. But if that adjustment becomes less effective, you may notice dizziness, blurred vision, or even the feeling that you might faint. Here's something worth thinking about. Has your morning dizziness become more frequent than it was 6 months ago? Does it only happen occasionally, or has it slowly become part of your routine? Small changes over time often provide valuable clues that shouldn't be ignored. One woman in her late 60s believed she simply wasn't getting enough sleep. Nearly every morning she felt lightheaded while preparing breakfast. Because the sensation disappeared after a minute or two, she never mentioned it during medical appointments. Eventually, after experiencing a brief fainting episode while gardening, she underwent a cardiovascular evaluation that identified an underlying issue affecting her circulation. Fortunately, it was detected before something more serious occurred. Stories like hers remind us that symptoms don't always become dangerous overnight. Sometimes they quietly become more frequent until they're impossible to ignore. But here's something even more surprising. The next warning sign doesn't involve dizziness at all. In fact, many people mistake it for indigestion, sore muscles, or simply sleeping in an uncomfortable position, and that's exactly why so many people delay seeking help. Have you ever woken up with an uncomfortable pressure across your chest? Not necessarily severe pain, but a sensation that felt unusual or difficult to describe? Maybe it disappeared after a few minutes, leaving you wondering if you had imagined it. Chest discomfort can have many causes: muscle strain, acid reflux, anxiety, inflammation, and digestive issues are all possibilities. However, discomfort that feels like pressure, heaviness, squeezing, tightness, or fullness, especially if it occurs with shortness of breath, nausea, sweating, dizziness, or pain spreading to the jaw, shoulder, neck, or arm, requires immediate medical attention because these can be symptoms of a heart attack or another serious cardiac problem. One of the biggest misconceptions about heart disease is that every heart attack begins with sudden, crushing pain. Reality is often different. Some people experience only mild discomfort. Others describe it as pressure rather than pain. Some women, older adults, and people with diabetes may have symptoms that are much less obvious than expected. That's why healthcare professionals encourage people to pay attention to new or unexplained chest symptoms rather than comparing themselves to what they've seen in movies. Imagine noticing the warning light on your car's dashboard. Would you continue driving for weeks hoping it disappeared? Probably not. Most people would want to understand what caused it before it became a much larger and potentially more expensive problem. Your body deserves that same level of attention because when it comes to your heart, acting early often provides more options than waiting until symptoms become impossible to ignore. Now let me ask you one more question. What if one of the most overlooked morning warning signs isn't pain, isn't dizziness, and isn't even shortness of breath? What if it's something millions of people simply describe as feeling unusually tired? That symptom may sound ordinary, but the science behind it is anything but ordinary. Have you ever woken up feeling as though you slept for 8 hours, yet your body feels completely drained before the day has even begun? You sit on the edge of the bed, take a deep breath, and instead of feeling refreshed, you feel like you've already worked an entire day. At first you blame your age, then you blame poor sleep. Eventually you stop thinking about it altogether because it becomes part of your routine. But what if that overwhelming morning exhaustion isn't simply a normal part of getting older? What if it's one of the earliest ways your heart tells you it's struggling to keep up? This is one of the most overlooked warning signs cardiologists hear about from their patients. Not because it's rare, but because it's incredibly easy to dismiss. Most people expect heart problems to cause pain. They don't expect them to cause exhaustion before breakfast. Your heart works continuously, 24 hours a day, pumping oxygen-rich blood to every organ in your body. During sleep, your muscles are resting, but your heart never does. If it begins losing efficiency for any reason, your brain and muscles may not receive the oxygen they need as effectively. Instead of waking up restored, you may wake up already feeling depleted. Now, it's important to understand that fatigue has many possible causes: poor sleep, anemia, thyroid disorders, certain medications, depression, infections, and many other medical conditions can all contribute. That's exactly why persistent fatigue should never be ignored or self-diagnosed. It deserves a proper medical evaluation to determine what's actually causing it. Here's something many people don't realize. Healthy aging may slow us down slightly over time, but it shouldn't suddenly rob us of the energy needed to perform everyday activities. If making breakfast, walking to the mailbox, or getting dressed becomes noticeably more exhausting than it was just a few months ago, your body may be telling you that something has changed. Think about your smartphone for a moment. When the battery is healthy, it lasts all day without any problems, but as the battery begins to wear out, it drains faster even when you're doing very little. Your body can experience something similar. When your heart isn't working as efficiently, even simple daily activities may begin consuming much more energy than they once did. One retired teacher in her early 70s began noticing that every morning she needed to sit down halfway through preparing breakfast. She wasn't experiencing severe chest pain, she wasn't collapsing. She simply felt unusually exhausted because the change happened gradually. She assumed it was just another part of aging. Months later, during her annual medical examination, she casually mentioned her increasing fatigue to her physician. That simple conversation led to additional testing, which identified an underlying heart condition that could be treated. Looking back, she admitted she had ignored one of the earliest warning signs because it didn't match what she thought heart disease was supposed to feel like. Her experience teaches an important lesson. Heart disease doesn't always announce itself dramatically. Sometimes it quietly changes the way you feel each morning until the new normal no longer seems unusual. So ask yourself this question honestly. Do you feel refreshed when you wake up? Or do you feel as though you're already running on empty before your day even begins? Sometimes the answer is as simple as improving sleep habits. Sometimes it's related to another health condition, and sometimes it's a conversation worth having with your healthcare provider sooner rather than later. But here's where today's discussion becomes even more fascinating. Everything we've talked about so far involves symptoms that most people can easily notice: shortness of breath, dizziness, chest discomfort, and fatigue. But what if the most important warning sign doesn't feel painful at all, and many people only discover it by accident while getting out of bed? In fact, cardiologists often say this final sign is one of the easiest to overlook because people rarely connect it with their heart. Have you ever looked down at your feet the moment you got out of bed and noticed something unusual? Maybe your socks left deep marks around your ankles. Perhaps your slippers suddenly felt tighter than they did a few weeks ago. Or maybe your feet looked slightly swollen, but because the swelling wasn't painful, you ignored it and continued with your day. At first, it seems harmless. After all, everyone experiences a little swelling from time to time. A long car ride, standing too long, hot weather. All of these can cause temporary swelling, but when swelling becomes frequent, appears first thing in the morning, continues getting worse, or is accompanied by shortness of breath, unusual fatigue, or chest discomfort, cardiologists encourage people not to dismiss it without medical evaluation. Here's why. Your heart and kidneys work as a team. Every heartbeat pushes blood throughout your body, while your kidneys carefully regulate fluid balance. If your heart isn't pumping efficiently in certain heart conditions, fluid can begin accumulating in different parts of the body. Gravity often causes that extra fluid to collect in the feet, ankles, and lower legs. This symptom is known as peripheral edema. Peripheral edema has many possible causes. It may result from certain medications, vein problems, kidney disease, liver disease, prolonged sitting, or other medical conditions, not just heart disease. That's exactly why it should never be self-diagnosed. The important point isn't to assume the worst. The important point is to recognize when swelling is becoming persistent or is appearing together with other warning signs. Imagine your circulatory system as an incredibly organized highway network. Your heart keeps traffic moving. Your blood vessels transport oxygen and nutrients. Your kidneys help control the amount of fluid traveling through that network. When everything is working properly, traffic flows smoothly. But if the heart begins struggling to move blood efficiently, congestion can slowly develop. Just like cars backing up during rush hour, fluid may begin collecting where it shouldn't. At first, the change may be subtle. Your shoes feel tighter, your socks leave deeper marks, your rings become difficult to remove. Many people blame aging. Others blame the weather. Very few consider mentioning it during a routine medical appointment. One retired gardener in his late 70s noticed that every morning his slippers felt tighter than usual. By afternoon, the swelling seemed even more noticeable, but because it wasn't painful, he assumed it was simply part of getting older. Several months later, he mentioned it during a scheduled checkup while discussing something completely unrelated. His physician immediately asked additional questions. Had he been feeling more tired lately? Yes. Was climbing stairs becoming harder? Yes. Had he noticed becoming short of breath while lying flat? Again, yes. Those seemingly unrelated symptoms together painted a much clearer picture than any one symptom alone. Further evaluation identified an underlying cardiovascular problem that benefited from treatment. Looking back, he admitted something that healthcare professionals hear surprisingly often. I thought every symptom by itself was too small to matter. And that's exactly why recognizing patterns is so important. One symptom may have dozens of explanations, but when several warning signs begin appearing together, persistent fatigue, shortness of breath, frequent dizziness, chest pressure, swollen feet or ankles, an irregular heartbeat, your body may be telling a much bigger story. That doesn't automatically mean you have heart disease, but it does mean those changes deserve professional attention instead of being explained away as just getting older. Now, let's take a moment to review everything we've discussed today. We began with unexplained shortness of breath after waking. Then we talked about frequent dizziness when getting out of bed. After that, we explored why unusual chest pressure should never be ignored. We discussed persistent morning fatigue and why it deserves medical attention when it becomes part of your daily routine. And finally, we examined swelling in the feet and ankles, a symptom that many people overlook even though it can sometimes be connected to heart health. Notice something interesting. None of these warning signs automatically confirm heart disease. Each has many possible causes, but together they share one important message. Your body often whispers before it screams. The earlier unusual changes are evaluated, the greater the opportunity your healthcare team may have to identify treatable conditions before they become more serious. If you ever experience severe chest pain, sudden difficulty breathing, fainting, or chest discomfort that spreads to your jaw, neck, shoulder, arm, or back, don't wait to see if it improves. Seek emergency medical care immediately. Those symptoms require urgent evaluation. Your heart has faithfully supported you through every conversation, every celebration, every challenge, and every moment of your life. Perhaps the greatest gift you can give it is simply paying attention when it asks for yours. If you found today's video helpful, consider subscribing for more evidence-informed videos about heart health, healthy aging, and practical wellness tips designed to help you make informed decisions alongside your healthcare provider. And before you leave, I'd love to hear from you. How old are you? And which of today's 5 warning signs surprised you the most? Leave your answer in the comments below. Your story may encourage someone else to seek help at exactly the right time. Thank you for watching. Take good care of yourself, stay healthy, and I'll see you in the next video.